Sickle cell disease is a hereditary blood disorder. Think of your worst period and multiply it times
Oh.
10, $500 for each prescription bottle that you get. I'm like, closed mouth don't get fed.
Hi everyone, welcome back. Today we are going to be sitting down with Kallie. Kallie, I'm going to transfer it over to you to introduce yourself to everyone.
Hi everyone, my name is Kallie Hargrove. I have sickle cell anemia, genotype SS. I am a travel nurse, originally from Mississippi, but currently located in Georgia.
Awesome. So just like Kallie just said, today we're going to be talking about all things sickle cell. So Kallie, what is sickle cell disease and when were you diagnosed with this disease?
Sickle cell disease is a hereditary blood disorder. So I was diagnosed around 3 or 4 months. I've always had sickle cell. When I say hereditary, that means that you're born with it.
Mhm.
But back then, testing wasn't done beforehand. So my parents did not know until I became severely ill and they took me to the hospital and they ran some blood tests.
I know that this is a disease that is very common, especially within the Black community. Could you speak on the importance of educating ourselves about this and also testing for traits of sickle cell?
It's so important, and especially to people of the Black and Brown community and even others, because it's not just like a Black illness. Hispanics get it. People who are Mediterranean descent, they get it as well. Blood is blood.
Mhm.
It doesn't see color. So, but it's important because, like I said, it's hereditary, and a lot of people don't know that they carry the trait. My parents, for example, didn't know that they had the trait until they had me, and I'm the third child of three. So they went through two other children, everything all good, and then get to me, and it's like, whoa, what's going on? So
Yeah.
it's very important, definitely for family planning. I'm so grateful to be here and to tell my story. But for like, I would like, to move on and to help I can eradicate this illness, this disease, this family planning is the perfect way to do that.
So what test exactly should someone like request in the doctor's office to test for this trait?
All they would ask for is a simple blood test, like, hey, I want to be tested for sickle cell trait. And you can get that at most routine physicals or regular lab visits, and it's quick, simple, and you can get it with your other labs. It's not something separate that you have to do. Is if you're
Okay.
already getting blood drawn, you might as well go ahead and find out.
So, like, I didn't know like it was so simple to test for it, but it makes sense because it's a disease that has to do with our blood. And I don't know if we actually like if we went into it when I asked you the first question, but if you don't mind again just reiterating, like, so what exactly is sickle cell? Like, what is going on in our bodies when we have this disease?
Okay, so a breakdown of sickle cell. It affects the red blood cells in our body. Red blood cells carry oxygen, also known as hemoglobin. When for sickle cell, the red blood cells aren't shaped normal. They're abnormally shaped. Regular red blood cells are circular, like a donut, and
Mhm.
sickle cells are shaped like a crescent or a banana or even a sickle, which is their name after the sickle tool from
Mhm.
like farming.
Okay, okay.
When those sickle cells can't get through to give oxygen to the other parts of our organs in our body,
Mhm.
that's when it causes all of the complications. And since blood flows everywhere, complications can occur any and everywhere.
Okay, because just making sure that this is explained properly, the blood cells help us carry oxygen to other parts of our body. But because it's in a different shape, not round, that oxygen cannot get on the blood cell to help us take care of the rest of our body.
Correct. The cells get clumped and stuck together in the blood vessels,
Hmm.
which causes all the other symptoms linked with sickle cell.
Wow. And what are some of those symptoms?
Some of the main symptoms are what we call a pain crisis. It's very extreme pain. I like to compare it to, I tell women, like, think of your worst period and multiply it times
Oh,
10.
oh my God.
It's awful. And other symptoms include stroke, um, removal of the spleen.
Oh,
Children get, they call it hand-foot syndrome, where their hands and feet swell up all very, very badly. Men get this thing called papyrism. I believe I'm saying it correctly,
okay.
which leads to erection for long period of times, and it's painful for them.
Oh my God.
Yeah, so I'm like, I haven't got a man.
Oh my
A
God.
man.
Jesus Christ.
So and that's just some of the few symptoms. It's also like retinopathy in the eyes, where the sickle cells get stuck in your eyes, and can cause blindness or blurry vision in extreme cases.
Wow. I did not know like it was that bad. Like I was kind of aware of pain crisis, but a lot of the other things that you're explaining, like I did not know that that's how bad it got with that disease.
Yeah, the pain crises are like the easy thing to deal with.
Oh,
If
oh,
you want to compare it to everything else, like I
it's the
think
easiest part of it.
right. I'm grateful that I don't have many of those complications myself. I do have retinopathy in my right eye
Hmm.
from my sickle cell, but I haven't went through a stroke. I haven't had to have my spleen removed. Most of my it's just pain crisis, and I'm those are awful, but I'm just like, thank goodness I haven't had to go through those other things as well.
How would you describe the way you interact with the health systems, particularly with your disease? Because you talked about like having pain crisis, you talked about all the other complications that come with having sickle cell disease, right? So in that situation, do you ever encounter challenges where like your treatment or your medication isn't covered? Is it something where, like, when you have a pain crisis, you go into the hospital, like everything is completely taken care of because you have sickle cell? Like, what are those challenges like?
Challenges in those areas, for me personally,
Hmm.
I rely heavily on my insurance for financial parts so I don't have to worry about that. I know, but you still have to pay like out of pocket for something because insurance isn't 100%. And then you're thinking, oh, I'm missing this many days of work, and now I'm gotta pay this bill. And as you get older, you're thinking about credit, like, oh, you don't want that to go on your credit. But a lot of times I work with hospitals, I ask for like payment plans and ways of whatever insurance hasn't covered. Um, I know some people they're on either like Medicaid or Medicare, but with this new, I know, administration, things are getting cut. So hopefully
Yeah.
that doesn't affect a lot of people.
Okay. So now that you kind of talked about like that reality of having a pain crisis and potentially like having to take time off work. So when you are applying for a job, do you declare that you have sickle cell? Is it something that like your employers need to know to take into consideration? Or, is it just like when you get there, if you do experience a pain crisis, you just tell them and they accommodate you?
Thankfully, when every employer that I've had, I haven't really had to worry about backlash. I don't tell people up front because I don't want the judgment, especially being as a nurse.
Yeah.
Like, that can go good or bad. It just really depends on the manager, the people who are receiving you. But I usually wait until maybe if I get sick, I tell them, "Oh yeah, you technically, better law, you don't have to disclose if you have a disability.
Okay.
If you are filed with your employee, the disability side, you don't have to reveal that information. They can just, oh, you had this doctor excuse, you had this doctor's note, and that's it. So." I really do it a case by case. I'm like, okay, this manager and supervisor, I feel comfortable telling them this and
Okay.
that. Others, I'm like, I don't want to reveal that information.
Okay. So then when you experience a pain crisis, is it, do you have to use PTO to take care of yourself while you're sick on those days, or is it sick days, or is it just like unpaid time off while you're taking care of yourself?
So currently, because I do travel nursing, whenever I miss work, it's not paid anymore. But when I was like in the staff nursing position, I did have PTO that would get used or nurses, we don't, I never, well, the hospital that I worked at when I was a staff nurse, I didn't have we didn't have sick time. We just had our PTO that we occurred. So
Mhm.
it would be used through that. And I would try to just get people to change shifts. I would have good managers who would like move my schedule around and help me with that.
You're saying that like you're very lucky that you were able to be like in a good job with managers that worked with you. Because I
Yeah.
can only imagine like if it was somebody who wasn't in that type of position, right? Or wasn't like in a salaried position per se, and it was like a minimum wage job, it wasn't salaried, and you experienced a pain crisis. And so it's like the challenges of what if they're like, yeah, you can take the day off, but you're probably not going to get paid. Um, Maybe you have challenges like accruing PTO, because I know that especially with when you talk about health disparities, a common challenge that we overlook is people who work like minimum wage jobs. And you're like, oh, you can just take the day off. But that day off means that I may not be able to pay my bills. Or like
Exactly.
in your case, when you were talking about like, okay, I'll end up in the hospital, insurance doesn't cover everything. And now I have medical bills on top of the fact that I may not be able to get paid. So it just helps me understand that like there's so many challenges that people are facing and so many decisions that they have to make that like everybody doesn't have the liberty to just take a day off because they're sick, even though they're in excruciating pain.
That's so true. And I know with things like that, there sometimes there's resources through each state usually has a foundation for sickle
Mhm.
cell, and you can reach out to the foundation and see what ways that they could help you in those situations.
Mhm.
I know, like me personally, with my state of Mississippi, my home state, they have a fund accounts like for you. Oh, you are behind on this because you have sickle cell, so you've been in the hospital or you didn't get to work or da. They will be able to give you a certain amount of funds a certain amount of times. So there are different resources to help look for things to compensate for missing from
Mhm.
work. I know
Yeah.
it probably equivalent to entire amounts,
Yeah.
but there are ways to look and help. And always, I'm always encouraging people to talk to the social workers.
Oh,
That's their job. They're there to help you and give you resources.
wow. So then another thing I wanted to ask you was because is that when you are like trying to pick your health insurance like annually, are there certain things that you keep in mind when you're selecting your health insurance because you know you have sickle cell?
Yes. So I'm still health insurance still feels like to me it's such an adult thing.
I feel you. I feel you.
I'm always
I'm like, I want to get back on my parents' insurance. Like, this is a lot.
I always call my aunt. I'm like, okay, help explain this to me. I'm like, I know I need the best one. I'm like, I don't care how much it costs. I need the best one because I know there's always that chance that I might end up in the hospital. Yes, I can go
Yeah.
weeks, months without an admission or having to go
Hmm.
to the emergency room. But the reality of somebody living with the chronic illness and sickle cell is you need good health insurance. So I always try to make sure I just get the best one possible.
So, what would you define as like the best one, best type of health insurance for you? Like, what are some key things you would look at when trying to select it?
I look at copays, like how much I have to pay in a copay, if something I
Hmm.
don't want anything outrageous. the prescriptions, who it's going to cover for the most of my prescriptions. And then they're usually like the percentage of how much they're gonna cover. A lot of people places will cover like 80%. I want that versus the place that's only gonna cover half.
What about like deductibles? Like, is that something you pay attention to?
A little bit because I still don't really fully understand the
Understand.
deductible.
Okay, because I know like one area of an area of concern is like deductibles, right? Because I'm currently in that position where it's like you have your regular preventative care that they pay for, and
Right.
then it's like, oh, you have a deductible for like 5,000 or 6,000 or 2,000. And so then it's like you have to pay out of pocket within this gap before insurance like fully kicks in,
Right.
right?
Okay.
And so, like, I would think, like, if you're somebody who frequents the hospital a lot, is that something that you keep in mind, like how much my deductible is before it fully kicks in? Or you're just like, it doesn't matter, the best one.
Me, I said, just give me the best one.
Okay, okay, no worries. No worries.
I know that doesn't apply to everyone.
Uh-huh.
And I got to do better at being an adult and getting that all figured out.
Yeah. Okay. I feel you. Don't worry. We're all like figuring it out. So what financial resources have you utilized to assist you with managing sickle cell, and how did you get access to these resources?
I remember with like one financial resource that I used is trying to get a medication that I really needed.
Hmm.
Insurance wasn't covering it, or what insurance was covering it, it was still costing me way too much. And that medication company had some type of program that all you had to do, I think your doctor just had to submit something for you and they covered everything.
Hmm.
So it's simply just asking. A
Okay.
lot of the times, if you just ask people, you can get help through these companies. They have the money, they have the resources. So like I said, talk to the social workers, let your doctors know your situations, because my closed mouth don't get fed.
So how would you encourage someone to start that conversation of, well, when you're in a situation just like you described, your medication isn't approved by your insurance, it's crazy expensive, you really need it to feel better, but you've never advocated for yourself regarding a health condition. How would you encourage someone to start it?
I'll encourage them by hopefully they have that relationship with their doctor, nurse practitioner, whoever that they see on a regular basis, that they feel comfortable enough to just let them know their situation. Like, and that way they can be directed to the right resources. Be honest. There's no time to hide the truth or be prideful when it comes down to your health. So, honesty and just making sure you reach out. Don't be afraid to do that, especially with the people who are they're there to help you. That is literally their job. Use them. Use them. Get comfortable with them.
When you started like advocating for yourself personally, did you find it easy to just open up about your finances to like the healthcare staff and the social workers?
Yeah, because I'm like, I don't want to pay. I can't pay for that either. I'm like, I don't want to pay. Somebody gonna have to figure this out. Y'all are gonna have to help.
And what are some names of some organizations, like sickle cell organizations that are like huge around America, or just like common organizations that people can look up to and reach out to for assistance, if you know any like off the top of your head?
Two that I think of the most is the SCDAA. It stands for Sickle Cell Disease Association of America, I believe.
Hmm.
And then there's the Sickle Cell Consortium. feel like I hope I'm saying that right.
Consortium, I
I'm
think.
not. Of course, there's some. Yes. Those two are some of like the biggest ones for the country. And then, like I've said, like most states do have their own foundation. You just put Mississippi Sickle Cell Foundation, Georgia Sickle Cell Foundation, whichever, and
Mhm.
directly puts you to that link.
Wow. So it's really just like a matter of asking and searching. And have you ever encountered a situation where, like, even when you asked, you were not able to be assisted, or are you assisted every single time?
There was a situation because I'm still fighting to get this medication. I don't know what's at this point. I'm like, I don't know what's going on. Like, one of my medications it's been hard to get like the authorization for it, and then yeah, at one point when I remember the last time that when I was able to get it, but there was like, oh, it's gonna be like $500 for each prescription bottle that you get. I'm like, no, I can't afford that. And they were supposed to be revamping everything for me and reaching out to people. I don't know where the ball was dropped, and that's on me as well because I should have followed up more, but I was younger back then when that was going on. So I just blame my young brain for not keeping on top of that. But that was definitely an issue at one point.
Wow. And so, what impact did that medication have on you? And what impact have you experienced since you have stopped taking it?
So for that medication is to help with my iron overload. I have to get monthly blood exchanges or transfusions like
Infusions?
every 6 weeks. So yes, it helps me, but it gives me another problem. It gives me too much iron in my blood. You hear a lot of people who are anemic or they have too low iron. I have too much iron because of the transfusions. And that medication helps lower that iron and ferritin number. And mine's just through the roof.
Okay, wow.
So that's been
Well,
my
then
obstacle.
what are the side effects of your ferritin being very high?
Organ damage. Thankfully, I have not,
Oh my God.
knock on would reach that point. And I
Oh
should
my
take it
God.
so much seriously, but I've been fussed about this since I was little.
And this is just an example of like one drug that you need to take where it's like $500. Will it be $500 for a month's supply?
So like a
Or
30-day supply.
so like every month, that is not by the end of the month, that's like at the end of the year, that's like $6,000. And that's just one drug, not even take into account like you may have like a pain crisis, you have other medications that you have to take, which are also not the cheapest drugs on the market. And
Mhm.
so it does add up over time. And these are like, the challenges of do I pay my bills or do I take a drug?
Exactly.
Wow. Haley, I know that you work in a setting where you take care of patients with cancer.
Mhm.
And so you have seen a lot about like pain and managing like a chronic illness to like an extreme. How would you describe the current like funding climate for patients with sickle cell comparative to patients who are experiencing cancer?
It's so different. Cancer patients, there's resources for everything that they need. And each cancer, the more common ones have more funding or more
Yeah.
research going on, but there's always something for them. There's always some type of funding available. The most famous ones like breast cancer, Susan G. Komen, they're
Hmm.
always, offering assistance to their patients. But on the other hand, with sickle cell, it's not like that. It's limited. And they were even like getting cut on the governmental level with funding for like research. So we're definitely not getting funding for us as patients who need things. So
So,
we really rely on our own personal foundations.
wow. And so you're saying that a lot of the funding comes from like individual like nonprofit organizations setting up something. And so it's really reliant on like people within the community, like taking it upon your heart to contribute towards it
Hmm.
compared to like cancer where there's a lot more government government resources that is also coming down to assist patients and communities with take managing the disease.
Right. And plus they're nonprofits.
So if you could change like one thing about the current like funding climate with patients for patients with sickle cell, what is one thing that you would like to change?
One thing that I would like to change with the current funding climate for patients with sickle cell is just being able to at least afford their medications. It should never be a question about, do I go get my prescription or do I pay my light bill?
Um,
And I know many people face that issue. Then they don't get their prescription, then that leads to other problems with in the healthcare system. They're non-compliant, they're not following the plan that we gave them,
yeah.
causes issues down the line for them in admissions.
Mhm.
They're not, and they don't get to be looked at the whole picture. They just, like I said, they're called non-compliant and disruptive, not caring about their own health.
Wow. And I totally agree with you on that because I think even as someone, like when we're trained, because we're both healthcare workers, when we're trained in school, it's kind of like if you don't show up to take your meds, you're non-adherent, you're not taking it seriously. But I think oftentimes we're not educated to understand that there is a whole human being beyond the four walls of this health center and they went through a lot of challenges and hurdles before they even made it here.
Hmm.
And sometimes it's really that, like, I don't have money to take this drug to be adherent because I have not even been able to have food to eat today.
Right.
And that's just the reality. Like, I have to pick and choose, and it's like you're between a rock and a hard place. Like, there's no win. So, what advice would you give someone who is in a similar situation as you, on how to manage the financial burden associated with sickle cell?
Advice I would give to somebody, plan. Always plan. Plan is when you can set aside, because at the end of the day, we can't rely on anybody for real besides ourselves. This is us. No one's gonna
Hmm.
care about you besides you. Like you, so plan for those things. I know it's kind of hard to sometimes life happens,
Yeah.
but if we can at least do that part and have at least some type of emergency fund for things like that, just dedicated to prescriptions or hospital. But even when you go to the hospital, like you just need food while you're in the hospital because always the hospital food isn't the best. Like little
Yeah.
things like that. Plan if you can and when you can. And like I mentioned before, don't be afraid to ask for help. Like closed mouth don't get fed.
Closed mouths don't get fed. Wow. And I guess this just expands on the importance of having an emergency fund because a lot of times like we talk about it in the financial space like have 3 to 6 months of an emergency fund just in case like your job lets you go or something happens, but I think even in America, like you said, you can't really rely on anyone but yourself. It's like intentionally setting aside that emergency fund for in case like a health condition comes up or a pain crisis or just whatever. So you have some sort of cushion to get you through that season in some way, shape, or form.
Hmm.
So, what are your closing words, Kallie?
My closing words is I hope that people who are watching this have learned something from this conversation between you and I, and will go out and educate themselves even more about sickle cell. And those who have sickle cell who are watching this, I hope they got something inspirational or even some good advice out of this as well.
Awesome. Thank you so much, Callie, for speaking with me today. It was definitely an honor, like learning from you, learning about sickle cell and the challenges that people with sickle cell face. And for everyone else, thank you guys for listening to us and looking forward to seeing you guys on the next one.